Okay, well, let's get started. So there's 24 panels, or maybe there's 25 in the present version of the iMate system. We're working on a few new panels. Okay, you go in, let's use Joe Public for now. Oh, it's a follow-up visit, right? Always, follow-up visit, even for Joe Public. And you always want to do the calibration no matter what you do. If you plan to do anything, if you charge a vial or you make a remedy or one of those things, if there's not a human, a living thing involved, you can skip it. But even in Metaspace, by the way, the webinar from April about Metaspace is finally cleaned up and will be posted later today on the YouTube channel, okay, under the archived webinar playlist. I cleaned them up so as not to waste your time, to get rid of some of the dead spots, etc. All right, always calibrating. Okay, a lot of these have a reactivity function. Okay, one that does not is the Sarcode panel. So as far as the Sarcode panel is concerned, it's pretty self-explanatory. The question is, what are you going to treat? So you have to use something other than a reactivity to kind of guide you. So you just have to correlate it with, clinical experience, with what the person is going through. There's a couple things I just want to point out that you may not pay so much attention to. One is the medulla oblongata, is the brainstem, okay? So when there is vomiting involved, hiccups, well, the brainstem is very important. It's the reptilian brain. It's the so-called reptilian brain. So the brainstem, which is sitting right here in the back, like in the center of the brain. Like here's the thalamus, that little knot here, and then below that is the hypothalamus, and it's basically the thermostat that monitors everything. It basically monitors your blood, but it monitors literally everything. And a lot of stimuli comes from here. If there's not enough nutrition, it will make you hungry. If there's not enough oxygen, it will increase your heart rate, and so on and so forth. So anyway, the brainstem is the so-called reptilian brain as far as evolutionary thinking is concerned. It just simply means it's the autonomic nervous system. It is the automatic part. Here, this cortex here, that's where all the problems are. That's where we learn stuff. You know how 2-year-olds are so sweet and so innocent and so beautiful and so awesome, and then they learn, and then they turn 7 and they turn 14, and then they've learned all kinds of stuff, and they're not so sweet anymore. Sometimes they're still sweet, but anyway. What I'm getting at is the cortex is where we do our thinking and our calculating. Okay, so the occipital lobe is more involved in vision, let's say, okay. Parietal is language and things like that. Temporal lobe is also kind of learning. The frontal lobe is emotional stuff, okay. Cerebellum is movement. Cerebellum is coordinating muscular movement, like running and balancing. So the way I do this, I muscle test. I make those decisions on muscle testing, but you can just use your intuition, of course, which is in the category of muscle testing, but you can use your intuition any which way you know how to, or you just use if it's obvious, this person has adrenal exhaustion, severe, the adrenal, if your intent is to support the adrenals, you just go to the adrenals and do a feedback. All right, Sarcode panel, it's, when you need to treat an organ directly, that's a very powerful thing. These are frequencies of organs, which to me, of course, an organ is a huge entity. It's got trillions of cells. Well, it's got billions of cells. I mean, the brain, for example, the brain has 10 trillion cells, or the nervous system, I should say, includes the nervous system. But anyway, so you can do feedback on, and like immune, immune is pretty general, so I don't use that too much because I get more specific when it comes to immune function. So the medulla, for example, the brainstem, is just below the hypothalamus. So the vagus nerve is a very important entity. It innervates everything from basically the mouth on down to the diaphragm. So the vagus nerve is very important in the upper body, everywhere. Your throat, your heart, your lungs. It doesn't go as low as the ileocecal valve, because I've been looking for the nerves that control the ileocecal valve. So if you do that, you do the vagus nerve and you want to do some detoxification of that nerve. Nerves also have to detoxify. Every single cell in a body detoxifies. It's called autophagy. And so, for example, the gene ULK1, okay, is a detox gene at the cellular level. Of course, that gene is only in the newest version of the software. So I just want to bring home the point that every single cell has to detoxify. So a nerve as large as the vagus nerve, of course, there is, millions and millions of cells are part of this vagus nerve. So of course it has to detoxify. So if you feel that's what needs to be done, of course you can also possibly, infections are inside of things. I'll get to that in a minute somewhere else. For example, in the ears, right? You can definitely have an infection in the ears. So you may want to add that as an additional feedback. Now, the way it is functions here, the software, is that, you have ears, right? And you do your feedback. I'm going to do it in Metaspace because the box is not hooked up. So what it's going to do, it's going to do ears as long as you've put in here. So if you put in here 20 minutes, it will do ears for 20 minutes. And then at the very end, it's going to add these things 30 seconds each. So that is the reason why I usually I'd like to emphasize this more. That's why we have the quick cycle function in the other panels. So I do just 5 minutes at a time. So instead of doing 20 minutes, I do 5 minutes 4 times, which is also 20 minutes. And then this gets expressed 4 times at the end of each 5-minute period. All right. So if you want to emphasize this a little more, just do less time here and then repeat it. So the only consequence of that is you have to watch it and you have to click the button again. So in the clinic, that's a little bit of a hassle because somebody's got to go back to the treatment room in 5 minutes and click the button again. Now, some of our patients are so versatile, they've done this so many times, you can actually tell them, okay, when this stops, just hit that button again, and they're good enough to do it. So you see, as a matter of fact, it's now doing detox. It just went to infection, it's now doing detox. Okay, that was those 30 seconds. Now it's done. So the advantage of this is, so now if we do it again, it will do 1 minute ears, and then it will do 30 seconds of this, which is half a minute of infection, half a minute of detox. Just wanted to point that out. Okay, so that's Sarcodes. So let's just go over here to these panels, okay? Because these are the other ones. So I want to start today and Friday. I'm going to talk about these kinds of panels. There is 9 here, plus the Sarcode we just did is 10, and there's some other ones. The lymph profile panel here is a fantastic panel. They're all good. Everybody has someone that has lymph stasis. It's very common. A lot of times it's caused from side effects from pharmaceuticals, or just if there's already illness in the body, like diabetes. So you see it most commonly in the ankles. I mean, I always look at people's ankles when they walk into the room or when I walk into the room, and it tells me, if there's congestion, and it's usually lymph, So let me explain it over here. This automatically takes you over here. So biospecific means it's a condition, okay? So lymph stasis is a condition. The lymph is not moving. And by the way, just so you know, okay, lymph is not pumped by the heart. It's pumped by muscle action. If you're not active, your lymph is not being pumped. That's why activity is very important, especially, physical activity. In that regard. Now, lymph stimulation is not really a condition, it's really a therapy, but they're very similar. But what these biospecific and all these panels are set up the same way mean is they really mean health conditions, okay? So biospecific stress is a code word. If you know somebody has these certain issues, you can just come here and use one of these frequencies to do a feedback. And then again, so sarcoidosis to me is it's an autoimmune condition. So autoimmune usually is because of course, it's inflammation. It's always involved in autoimmune, in all autoimmune conditions, pretty much. Inflammation is involved. It's just playing out in different tissues, either in the skin or let's say MS, for example, or something, it would be in a nerve, in the myelin sheath, the insulation part of the motor neuron, or the nerves. And then ALS is the motor neuron itself, which sits in the spinal cord. So anyway, so sarcoidosis, for example, you would want to do inflammation, and infection is always suspect. Infection is all. In fact, people that have autoimmune conditions have lots of chronic infections, and as you start going through your protocol, let's say the show method protocol, to reduce their what I call allergies, then the immune system will be able to focus more on what it's supposed to do, which is fight infections. And then you find that they have all kinds of chronic infections that have just been sort of dormant, So anyway, I would add those two, for example, here. So that's biospecific on the lymph panel. Then you have the category anatomical. So for example, of course, the main anatomical thing is the spleen, but every lymph node in the body, and there's tons, there's like 200 and 113 in this case. So a lot of the lymph nodes, or maybe all, are listed here, okay? And they're very specific. So if somebody has a spot on a lung, for example, okay, here are the cervical nodes, they're superficial and deep ones. This one can be pretty important, like when there's breast cancer issues. This one is often swollen. You can kind of feel it. It's on the left side. The bad one is on the left side. And the reason for that is because the thoracic duct, which brings up the lymph from the lower body back to the heart, basically to the vena cava, which is the big return of the blood to the heart and dumps it into the vein that goes in the heart to be then pumped through the heart and re-oxygenated, right? So anyway, the thoracic duct connects right under your left clavicle. As a practitioner, I always palpate for that node in particular, because it gives me an early warning that there is some trouble somewhere below. It's very profound in breast tissue, in particular breast cancer. Of course, there's other nodes, lymph nodes that you can palpate for that. These are lymph nodes in your intestinal tract, right? I just wanted to point out, if I can find it. So lung, I'm looking for lymph nodes in the lung. Pyloric pulmonary nodes. All right, well, these are all of them, but they're singularly noted as well. So if somebody has like a medical imaging result, and they say this, they will actually give you the name of the node, and you can look for it here. And what that does, so what I'm getting at is, so you can pinpoint or focus your treatment, and that means you can draw the focus of the body to these nodes here, okay, by doing a feedback on those particular nodes. Because if you just say lymph nodes, the body doesn't really know, well, where do you want me to go? There's 113 of them. So this will focus it to the lungs. So then if you, let's say you're giving the patient also, or the person also, glutathione, okay, which is a detoxification amino acid, especially needed in the lung. If that's the strategy, which is also always helpful, then it will focus it on those nodes and help to detoxify them and decongest them and start making them, less swollen and deteriorate into malignancy. Of course, vitamin C is also good for the lungs, and sulfur, vitamin C, and glutathione are the three nutrients that are very lung specific. And if the lung is in trouble, or you don't have to wait until you're in trouble, but anyway, they're suspect. Those are good nutritional supports. All right, so the thing is, what these panels allow you is to be very specific about where you're going to go, where you want the body and the immune system or whatever focus on, because it's a large body. And I mean, especially when there is illness involved or some kind of trouble, it's important to not do a little bit here, a little bit there, and because body does that all the time, every day, just to keep you alive, but to actually focus the energy, whether it's the healing energy or whether it's a nutritional intake, to a specific, very specific anatomical place in the body. That's what these panels are really good for. So let me point out this panel here. Okay, so what are you going to do about the ears and the eyes? There's not much external physical stuff you can do. You know, I mean, the technology that we have nowadays when you go to the ophthalmologist is just incredible. You know, they can change your lens, they can poke holes in here and change your focus and do all kinds of crazy stuff and visualize, and it's awesome. It's amazing. But other than that, you're stuck with the body to do something. And so in the ears, it's the same thing. I mean, you know, you can look in, and basically once you hit the tympanic membrane, kind of you've reached the end of the line. You know, you can't go any deeper than that. That's it. Even the ear doctor, he can't go any deeper either. So I just want to point out one phenomenon that I've, you know, I always learn on myself most, and then I notice it on other people. So when you hear someone saying that, well, you know, my hearing aid, it's great, but it's not really doing the trick. Like, I still have trouble hearing people at the other end of the table, across the room, and so on. It's probably because the doctor, the ear doctors always, you know, they always look and check for damage to the auditory nerve and what have you. Their thinking is physical. Well, but anyway, sometimes it is that, but a lot of times it's actually eustachian tube dysfunction. So what the eustachian tube does, it goes into your trachea, you know, it goes into your pharynx, which is your, let's say, your throat, fairly high up, you know, right? I guess it's below the tonsils, so right around there anyway, someplace. You can feel it drain. I mean, I can feel it drain. And that's what they're for, to drain and to equalize the pressure so that the tympanic membrane can function properly and actually swing back and forth as it, you know, as it transmits the sounds that come into the ear. So a lot of times the reason why you can't hear or your ear feels plugged is because the eustachian tube is plugged. What can you do to open it up? Well, it depends, you know. Not much medically. There's really no stents that can be put in. Even so, it's a big problem. I hear them talk about it. So what we can do is we can go. So where are we? Let's go to anatomical. Okay, let's find the eustachian tube. There's the eustachian tube. So we can focus a treatment, whatever we have in mind, to the eustachian tube and get some results here quickly. Even so often, you know, when these things go on, you have to do it more than once. You have to do it really until the thing is resolved. It's taken me 2-3 weeks at times to open it back up. All right, so the first time I had this problem, it turned out to be a chronic, you know, viral infection. Particularly, it was the mumps virus, okay? And it still, once in a while, tries to make a comeback as an issue, but I think I got it pretty much, you know, eliminated. But it took me quite a while, and, you know, I thought somebody else may be able to help me, but I had to figure it out myself. So if you type in mumps, for example, okay, there's a whole list of mumps viruses. This virus 44 seems to be the chronic version of the mumps virus. And then, of course, there's the vaccine, MMR, and so on and so forth. So I treated myself multiple times with this virus 44. It seems to be the chronic version of the mumps virus. Believe me, it is very common. So then, of course, the question is, so how do you do that at the same time as you are working on the eustachian tube? Well, right now, functionally, you can't, because the eustachian tube is not in the allergen panel or in the main reactivity panel database. So maybe it's important enough, I may actually add it over there. It's just hitting me now that this is just something that needs to be done. But right now, what you have to do is, so you have to do it separate. You have to do the eustachian tube and the virus separate. So what I do, of course, I have the vials for the virus. So I just have the patient hold the vial for the virus, and I'll do the feedback on the tube at the same time, on the eustachian tube. Now you can make a vial, you know, go back to the allergen panel, click on the virus you want to do, put the neutral vial on the interface box plate, and just imprint it. Okay, with the harness function. And 30 seconds is enough. Okay, so I usually just put this down to a minute so I don't have to watch it. I click it, and you know, and you have made yourself a vial for the virus 44. If you don't want to do that, or you can't do that somehow, then you can do it consecutively. You know, you do the virus first, and then you come back to the, you know, in the same session. That will also work. In energy medicine, there's many different ways. There's no 100%. It's always you do the best you can and the body will respond. But I just want to raise the concept of that, if you have a chronic mumps virus in the eustachian tube, there is nothing that can be done, and will go on and on and on, and you'll get misdiagnosed and you end up with hearing aids, and they're going to be very frustrating. So you can focus the immune system specifically on the eustachian tube, which is awesome. And that is true for any of these things. The macula, I look more as nutritionally, if you want to get certain antioxidants. If you want the body to focus, just imagine. I mean, you have 220 different tissues that the body has to maintain. So now you want your body to focus on the macula and put something that you're taking mostly at the macula, not all over the place. Well, this is a way to do that, to focus. And then, I want you to consider to think about imprinting these frequencies into a bracelet, which we manufacture with Smart Health, our non-for-profit, or put them in drops and a dropper bottle and have the patient repeat that at home, just to continue that focus, over time. And whatever macular formula you like or you believe in, or you have, think that it works. And then you can add in a treatment here in the feedback, you can add some emphasis. So macula degenerates because of oxidation, just unhealthy, not enough nutrition, too many toxins. So it's also something you want to detox. There could be some infections. There certainly could be inflammation. So I would maybe put those two in together with the macula. Now the outer ear canal, that's easy to get to. You can get to that one even with a Q-tip. So people sometimes have some sort of infection in there, like even things like a little boil or whatever. But that's easy to reach from the outside, so it's not so important. All right, so that is what this panel offers. And when you need it, it also, of course, goes to the eye. So once you realize that and you get into that, there's forget about everything else, literally. You just go to the iMate. The one thing about, but it's true for everything. Like if you have a chronic Epstein-Barr virus that's been in the body for 30 years, one treatment is not going to eliminate it. You're going to have to remind the immune system over and over again to stay on top of that Epstein-Barr virus to get rid of it 100%. And that takes a sustained reminder. It's almost like a little kid, you have to just keep reminding them patiently. And eventually it will be finished. The job will be done. The virus will actually be 100% removed from your system by your immune system. And if you need to, let's say you need to detoxify the macula, well, that's not going to happen all at once either. You're going to have to stick with that for a little while. You're going to have to do a session of treatments, maybe even 10 treatments. You got macular degeneration. I guess they have some treatments. I'm not sure what they do for that. But anyway, it's just a red flag that really, the macula is at the end of your optic nerve, so it's really part of your nervous system, and it's something you want to heal because the trouble continues on the inside, on the nerve and into the brain. All right, wow, I got a question. Awesome. Nina is asking, can you recommend any treatment for sleep apnea? Oh boy. Okay, so tinnitus, also asking about tinnitus. So what I was just talking about with the eustachian tube, that's very much part of tinnitus. Okay, a lot of tinnitus, or however you pronounce it, is because of just that. So it's important to kind of work on that. Now, let me see on the biospecific. Do we have tinnitus in here? We have it in a couple of different places. And I don't know, there it is. I don't know how effective it is. I use that as a feedback, and it's in some other panels too. But tinnitus is a symptom, okay? Remember that. Tinnitus is a symptom. So you want to kind of always think about what's the cause? What's causing this tinnitus? Is it the auditory nerve being degenerating? Is it the inner ear, is it the semicircular canals that are deteriorating or degenerating? Is it, more often than not, you will find that it's actually the eustachian tube. So always make sure that, and by the way, the nervous supply to the eustachian tube is trigeminal nerve and I think vagus, a branch of the vagus nerve, but mostly trigeminal nerve. Maybe it's maybe facial nerve, but those are so-called cranial nerves. So you can always go to the allergen panel and put in a search function trigeminal nerve, and it will pop up, and you can put that in the treatment. That's always a good combination to kind of wake up the nerves that innervate this thing. Because so the eustachian tube, I always thought maybe it's just hanging in there and it gets plugged up, and it's just like this hose that's hanging in your head there. But no, it's like everything else. It has nervous innervation and there's nerves controlling it. Okay, so sleep apnea. Sleep apnea is complicated. There's usually multiple factors. So the first thing you have to do is you have to get rid of the allergies. And of course, you got to get rid of the chronic infections. And of course, if there's an obesity issue, that has to be handled too, because if there's too much flab in the throat, I mean, no matter what you do, it's just not gonna, you're gonna have to get rid of that extra tissue. But if it's, let's say a average human, I look at it mostly, after that, I look at it mostly as a neurological issue. Okay, so your throat is innervated by nerves, multiple nerves, vagus, trigeminal, phrenic nerve. Those are the three cranial nerves which innervate the throat. So all these could be stimulated. And then what I do, and now I do this myself too, of course I've been doing it, you have to do these things. When it comes to exercises, I mean, you have to do exercises for years, okay? That's just how it is. You can't stop. So as far as sleep apnea, you have to exercise the muscles in your throat. So I recommend, and I do myself, a certain, because I don't want to snore, okay? The snoring is one of the symptoms of sleep apnea, and that's, unpleasant. So I do an exercise where I breathe. You can breathe, and I'd like to talk about, visualize, you visualize it, Darth Vader. If you remember Darth Vader in, I think it was Star Wars or something.
I'm such an idiot.
Okay, the way he was breathing. So you breathe in through your nose, deep breath, and you engage your muscles in your throat, and you purposely make a sound like breathing in, and you breathe out through your mouth. So you make that sound, engaging your muscles in your throat, and breathe out through your mouth. We may have to review that at one of our seminars. But anyway, try that, and you do that for a couple minutes max, but you have to do it, let's say, as often as you can, a few times a week, until you will notice it will improve. It will improve, but you may have to stay on it to keep exercising these muscles that operate your throat and all these things that we consider, automatic and we take for granted. All right, let's see if we can do another panel. This is one of my favorite here because, I've used that on myself and I use that on my patients a lot. Well, we might as well just start with number one here, up here in the left corner. All right, well, here we go again. So what are you going to do about the heart, right? Especially if it's a physical problem. Let's say one of the heart valves is leaky, it's not working right for whatever reason. Then, you want to think rehabilitation. So how do you rehabilitate a heart valve? I mean, they just replace it, but then you're on blood thinners for the rest of your life. So if that's what it takes, that's what it takes. That's what medicine is for. They're good at that. They can replace a heart valve very good, very nicely, very, very skillfully, and with few problems. But if there's a possibility of rehabilitation, that should be explored first. So you know which valve it is. Probably your doctors told you, and so you can again focus the rehabilitation efforts of the body, the repair mechanisms, which are substantial. They're impressive, okay? But it's a big body, and there's so the mitral valve is made of cartilage. So there's cartilage, and then there's kind of a tendinosis transition into the muscle, and then the heart itself is muscle. Okay, but the valve and its seat is cartilage. So the tissue that we want to rehabilitate and support is cartilage. All right, so what do you do about cartilage? What I've used in the past, which used to come out as an effective nutrition substrate, right, is glucosamine. It doesn't seem for me to work very much for big joints like the knee and the hip and so on, but it seems to work for heart valves. So anyway, again, we focus the body on the mitral valve, let's say, because you know, there's demands. Cartilage is needed everywhere. It's needed in every joint in the body, and there is like just dozens and dozens of cartilaginous joints, and they all want substrate. They all want to maintain their cartilage, and they demand that. So your body doesn't really know that this mitral valve is a big issue, and so this delivers that focus. So when you're taking glucosamine, and then do feedbacks on the mitral valve at the same time or during the same time period, it will help the body to focus and put more of that glucosamine onto the mitral valve area than everywhere else. So it's just simply a focus, but it makes a world of difference, you know. It cuts down on the time, you know. You may see, we've seen a difference in, you know, the leakage there within 2 months, more than 20% improvement, less leakage, and so on. Okay, that's what we use this panel for most, for little things like that. So let me see, the atrium, the nodes. Yeah, the heart muscle itself is not even in here. Okay, the heart muscle should be in here too, but it's not. So then you have to go to, you know, remember the Sarcode panel and so on. And then, of course, there's the biospecific, which is our symptoms or rather conditions, you know. And those you just have to, you know, you go with whatever diagnosis you know is there, or with what you think. I'm a little skittish about aneurysms because I've had a couple of catastrophic events. There is a time when it's time to seek medical care and medical intervention. Okay, any sign of an aneurysm is such an indication because they're not to be messed around with. So if there's no diagnostic indication and you're just trying to whatever prevent anything, a family history or so, that's fine. But if there is actually signs of, you know, any kind of aneurysm, I strongly advise medical care. Some of these things are a little, you know, I've never used that frequency once in 20 years because I mean, if I want to prevent a heart attack, I do not. This is not the way I do it. But anyway, they're in here. So there's a question about autism, and again, autism is a very complicated topic. There you have to really work on the genes. It's a genetic issue, you know. Well, many of these things are genetic, but I'm just explaining these other. Okay, so if I type in autism, you know, it's mentioned in some of these things. So for $200, you can get a genetic test profile, which is really worth it. And as a matter of fact, if you work with us, the lab that we're associated with Bob Miller, well, it's not his lab, but he does, you know, he started interpreting the genes and what they do and putting it into perspective. And I work with his system and it works really well. So anyway, you know, you have to identify the genes that are not happening properly. And this is very effective in resonating them to a higher level of function. And it's a little tedious, but you have to go through just the show method program. And one of the first things you need to do is get rid of the food allergies. And also, well, we know that food colors a lot of autistic kids are allergic to, you know, so that's a detox issue. And of course, detoxification is huge in autism. So there you have to go through a methodical thing of eliminating allergies, upregulating detoxification, getting rid of chronic infections, all those things. Well, we'll be talking about, I don't know, because at the moment we are in this COVID-19 craze, you know, I've been talking a lot about the immune system. So I don't, and probably in San Antonio, we're going to be talking about that. But anyway, what I'm getting at is that we're about due for a detoxification seminar webinar. But I can tell you already, you know, detoxification is regulated by genes. It's a genetic thing. You know, when it comes to autism, you can also use this. So Rachel is asking about the chelation stimulation body on a detox. So I came here just to, you know, I've done it 100 times, but I just want to see one more time what comes up here under autism. Okay, a few other things, including a parasite in the lungs. Just look at these things, okay, and start working with them. I mean, you know, you have to. So when you do ADD, for example, so the trick in this panel, which we're not really talking about this panel today, is you run a scan and then you type in ADD for example, ADHD or autism, and then it will show you these results, but it will show them to you in the order they came up in the scan, which is helpful in order to kind of pick out the ones that you may want to focus on, because then they'll be at the top. All right, I just wanted to point that out. So full body detox, I think, is what Clemens is referring to. Oh, no, Rachel is asking about the chelation, but I think that's what she's talking about. So the question is, what does it do? What does it do? Well, it does that. Well, you know, chelation refers to heavy metals mostly. Okay, so it stimulates heavy metal detox. So anyway, so this is a reactivity panel, and we're not really talking about those today, but I just want to say one thing about detoxification. It's not simple, it's not easy, it's complicated like everything else. So whatever you do here, just make sure you keep in mind that there's 3 phases of detoxification. Phase 3, which is bowel movements and bladder function. Phase 2, which is liver detoxification, and you want to make sure those things are working. So you want to have, you know, what's called downstream. These are the downstream mechanisms. You want to make sure they are functioning. Otherwise, you're doing more harm than good. You may want to have some binding things to take that will bind those heavy metals, for example, or toxins that you're trying to detoxify. And anyway, we'll talk about this again at some other occasion. So this is very specifically about, this chelation is more focused on the coronary arteries, okay? So this chelation here is focused particularly towards the coronary arteries. That's the difference as far as those two is concerned. But it doesn't mean it doesn't affect the other arteries, okay? But it's focused on the coronary arteries.